Infirmary Health is offering a special service. It's one that lets you get IV therapies or injectable treatments in the comfort of your home. Here to talk more about this is Laura Stough. Thank you for stopping by.
Of course. Thank you for having me.
So I want to talk about home infusion. I feel like that's something that a lot of people are exploring now. First, what is it?
Yeah, absolutely. It is receiving medication via IV or injection, even in the comfort of your own home. It's the exact same treatment that you would get in a hospital or a clinic, just in a different setting.
Okay, and there might be different reasons as to why a person chooses that route. It could be for convenience, or it could be because they physically can't.
Right, correct. And we treat a multitude of conditions, anything from serious infections like a chronic UTI to managing a more complex chronic condition like Crohn's disease or multiple sclerosis. Those are all great candidates for home infusion. And that also extends to people who need IV nutrition as well.
Okay.
Anybody who requires regular IV therapy or injections and is stable enough to be at home is who I would recommend it for.
Since we are on this, line of answering here, I do want to kind of explore more about who actually uses these services. So you mentioned Crohn's disease.
Yes, yeah. People, like I said, who are battling a serious infection are great, or managing those complex chronic diseases. But then also I like to include people who live in more rural areas. They might not live here, in the metropolitan area, and they might not have as readily available healthcare access. The convenience and the great thing about home infusion is we travel to you. So that includes people who live in those more rural areas, and also people who have transportation issues. If they don't have a reliable mode of transportation, it's not a problem. You can still receive treatment and receive that health care.
And I would guess that some of the benefits of having this service at your home is that you can go to them.
Absolutely. Other benefits obviously include we can come to your house 24/7, 365 days a year. So for people with really busy schedules, it's a great option who aren't able to make it to a clinic during open hours or something like that. It saves the patient typically a little bit more money in terms of healthcare costs and that sort of thing, and then time as well.
Yeah, I love the benefits. Time and money, those are two things that we could all use more of, right?
Absolutely.
How do you receive home infusion therapy? Do you let your doctor know that you want to do that?
Yeah, so the first thing I would tell a patient is to get in touch with your specialist. They would then get in touch with us, and we handle everything from there. We deliver the medications and any supplies that are needed, like pumps or IV bags, directly to the patient's door. So the patient really never has to leave the comfort of their home. And we also set up the nursing coordination and that piece of it as well.
Okay. Anything else that we haven't covered, because like I said, this is growing now in popularity.
Yes.
Is there anything else you want to add?
Yeah, I think a concern that we hear a lot sometimes from patients is they're worried about the safety of home infusion.
Okay.
I'm here to put everybody's minds at ease. It's not as scary as it sounds. Our team of pharmacists and nurses work really closely with your doctor to make sure that everything is done properly. And you're still monitored for side effects or any reactions to the medication. Okay. So I don't want people to not pursue home infusion because of worries about safety.
All right, sounds good. Well, thank you for stopping by and clearing that up.
Thank you.
That is good information that you will monitor them. So thank you for sharing that.
Yeah.